Without further ado, I would kindly invite the Permanent Secretary for Health to address the gathering.
Thank you. World Health Organization Medical Director for Deafness and Prevention of Hearing Loss, Dr. Shelley Chatter. The Australian Department of Foreign Affairs Trade Council for Development, Ms. Erica Ord, representatives of New Zealand Aid, the CEO of Frank Hilton, Ms. Serena Pereira, representatives of Koika, Dr. O, representatives of the Pacific Community, SPC, our international research and institutions and universities, non-government organizations, especially acknowledging the Fiji Association of the Deaf, the Fiji National Council for Personnel with Disability, and the Fiji Disabled Persons Federation. Pacific Disability Forum, MOH staff, ladies and gentlemen. Thank you very much for inviting me for this part of this important event in our yearly calendar. Today, the 3rd of March, marks the World Hearing Day with the theme of To Hear for Life and Listen with Care. In 2017, the World Health Assembly adopted a resolution which provided the guidance to member states to assist in their integrating ear and hearing care into the national health plans. Following on from this 2017 WHO resolution, a World Health Report on Hearing was published, which presented the epidemiological and financial data on hearing loss globally and outlined available cost-effective solutions and the way toward an integrated people-centered ear and hearing care. The report established that by the year 2050, nearly 2.5 billion people around the world will be living with some degree of hearing loss, and at least 700 million of them will require rehabilitation services, some of which would be included amongst us today. The report also proposed a set of key interventions that can be delivered through a strengthened health system to realize the vision of integrated, people-centered ear and hearing care. It is very timely that we are here with the main organizers and hosts today, the Frank Hilton organization supported by the Ministry of Health and Medical Services, and with the funding from the Australian government to celebrate the World Hearing Day and bringing more focus to this important health concern. Hearing loss affects an estimated 80,000 Fijians at some point in their lives. This represents a heavy medical burden for individuals, families, and communities, and most of these cases can be prevented through awareness, timely intervention, and early intervention. Timely identification and early intervention. I wish to acknowledge the efforts of the civil society partners like the Frank Hilton organization, who over many years have provided such services in community schools and in the CWM hospital, and supporting the ministry in delivering these services to those who need them. I am happy that we are launching today the inaugural symposium on hearing and ear and hearing care under the theme Collaborative Action Can Transform Health Systems. This symposium brings together critical stakeholders who can collaborate with going forward to foster a holistic approach for dealing with issues relating to deafness and the prevention of hearing loss in Fiji. This symposium is an important opportunity to learn, exchange knowledge, and discuss our future course of action through a collaborative approach that brings together the inputs from all the sectors and stakeholders, most importantly, the service users. The organizers can derive valuable information from the deliberations in the symposium that will inform the subsequent policy discussion planned for the 4th of March 2022. Through this participatory approach and with the support of civil society organizations and relevant sectors within the government, the ministry hopes to establish a long-term sustainable plan for the provision of a high standard of ear and hearing care services for all Fijians across the lifespan. We also understand that the scope of ear and hearing care extends beyond health services and into education, communication, and other support networks that assist persons with a hearing loss, their families, and communities. The multi-sectorial collaboration will ensure that the plans and the strategies we put in place will ultimately lead to the prevention of hearing loss and the provision of appropriate support for those with hearing loss, thereby minimizing the impact on the affected individual's health, social, and economic well-being. The ministry actually remains committed to the government's intent for universal health coverage and equitable access to health care for all Fijians, and is keenly supportive of the collaborative efforts with civil society organizations and development partners to ensure that all sectors of our communities have equal access to health services they need. I take this opportunity to thank the Frank Hilton organization for its leadership and initiative, the Australian Department of Foreign Affairs and Trade for funding this event. I also wish to thank representatives of WHO, Western Pacific Regional Office, for providing guidance in line with the World Report on Hearing recommendations. I am happy to officially open the symposium, and I wish all the participants a fruitful discussion and the achievement of the objectives of the forum. Thank you.